Don't forget this guy.
And
Best
yourself.
is always last.
Here we go. Alright. Okay, so hi, my name is Francis Fiefler. I'll be giving you a quick brief on an informative speech on the basic needs. Basically, it's a big deal over here in Italy because we drive on a lot of back roads that don't have street lights. And accidents happen all the time. Alright, so the whole thing behind it is like if you're the driver, even the passenger, and you get out of the accident, you're fine, but your buddy next to you is bleeding, or they have a fracture, or their intestines is all over the steering wheel, and you need to know, or at least the general way to treat these wounds. So, with, now we're going to go through it. So, go ahead and click. Alright, the first one is a facial wound. Of course, is anything that happens to the face, facial face, right? Apply direct pressure to the wound. Do not place fingers on exposed bones, wound edges around the wound. So if they're cut in the face, you can actually pinch the wound together to hold the blood so it's not bleeding everywhere. Alright, you want to check inside the mouth for teeth. Blood clots and sweep objects, to sweep the sweep objects out of seen. So if they have like teeth sitting in there, you can see them. You go in there, take it out so they don't choke on it and stop breathing. Monitor airway and breathe it constantly. Use appropriate size battle dressing, which is like a gauze for you guys that happen into a ship. Right? Do not obstruct the mouth and the nose. So obviously, if they're wounded, don't pinch their nose. That'd just be weird. If airway is not an issue, place on their back. If the wound is in the mouth or jaw area, place the victim face down with the wound on their hands. So they're going to be like this, face down. With their wound on their hands, it's going to prevent them from bleeding and apply direct pressure on it. Okay? And keep the jaw moving too. Next, you have fractures. There's all kinds of there's compound fractures. There's fractures that happen where they're not coming out of the skin. But the most common type of fracture that you'll see in most major accidents is a compound fracture that comes outside the skin. Okay? Apply direct pressure to the sides of the wound. Do not touch the exposed bone or apply pressure to that bone. Wrap a large battle dressing around the wound. You want to crisscross it, but do not tie a knot over the wound itself. All right, splint a limb in a position it was found in. Okay, so if this person has a bone popping out of their knee, all right, you're going to make a splint. A lot of that can be done with cardboard. It can be done with just about anything that you can find that's rigid. You can tie around. All right, but make that splint on their good leg. Don't try to fashion a splint on the bad leg, because that leg is messed up. So make a splint on the good leg and then transfer it over to the bad leg. All right, next. Amputations, which of course is someone has lost an extremity, whether it be fingers, arms, hands, toes, genitalia, whatever have you. So you control the bleeding, apply direct pressure, elevate the limb. So if you get cut off, say here at the elbow, right? Lift it above their heart, because so they don't bleed out. Okay. Locate and firmly depress pressure points. Mostly for the arms, it's going to be up in here, everyone knows, and when they apply, the tourniquet, whether you're giving their blood for PHA, or up here in the femoral arteries for your legs. Use a tourniquet as a last resort. That can be anything from a belt to rubber bands, or like if you work out and you have the bands in your thing, you can use all that stuff. But if you do use it, it's an absolute last resort. And right the time you apply that tourniquet on the forehead. So if you have a mark or anything, write it right there. All right. It sounds weird, but when you get to a ship or to a man that does this, it will tell you. You write for T for time and you write the time. All right, just so they know the doctor or the EMT when they come. And then find the limb, of course, and put it on ice. Next. Burns. You have 3 types of burns: first, second, and third degree burns. First, we actually get all the time. It's actually this one, which is a sunburn. Right, most common to us white folk. Okay. Second degree burn is going to be charring down past the epidermal layers of your skin, causes severe blistering. It is the absolute worst burn you can get is second degree burn. Which when you form blisters, don't pop the blisters, kind of leave it alone. Third degree burn, which is this last one, which is charred skin. It actually kills all your nerve endings and everything like that. You don't feel it. It's so bad you don't feel it. All right, it looks the worst, but it hurts the least. All right, moisten a battle dressing with some sterile water. Don't put it's in a puddle of water and then put it on a burn. All right, get some water bottle, pour it on the dressing, and on top of that, wait for it. Next. Smoke inhalation. Remove victim from the smoke-filled compartment, but make sure you don't become a casualty yourself. And monitor their breathing and give CPR if necessary. Of course, right? You see smoke, grab his feet, pull him out, stay below the smoke, so we're kind of on the crawl through the space. Next. Shock. Secure the power with the victim from the hazard. Check for unresponsiveness. Check airway, breathing, and circulation. Perform CPR. Treat entry and exit wounds. So if they touch something and the electricity goes out their other fingers, we're going to treat this finger and this other finger, right? Cover them with a blanket to keep them warm. Treat the shock. Next. Intestinal protrusion. It's obviously where your intestines are coming out of your stomach. Right, pretty gross. What you want to do is you want to kind of pick up that intestine, slide a bowel dressing underneath it, and then over top of it, forming what's called a gut taco. All right, do not tie a knot over the wound, obviously, because that intestine is pretty fragile. You can actually tie the intestines into the knot. Really gross. All right, check for other injuries and shoot the shot. Next, sucking chest wound. All right, this is when someone gets wound into their lung cavity, and it actually goes into the lungs, and you can see it bubbling and gurgling because oxygen or CO2 or whatever it is coming out of the lungs. Pretty gross. You want to take a piece of saran wrap, you want to tape it on 3 sides, not all 4 sides, right? Because air is still coming in and out, and you've got to let the blood drain. Okay, so you're going to tilt them on the side. Do not use your ID card. A lot of people will do that. They'll use their ID card, they'll slap it on there, and they'll try to tape it. That's a dumb idea, never do that. Just use a piece of saran wrap or a piece of plastic. If they have a wound in the back, like it goes straight through, on the back side, you want to tape all 4 sides, and on the front side, just 3 sides. Pretty easy. And then, of course, check for any other wounds. Treat the shock. Next. That's it. That's the 8 basic wounds. That's the most common wounds that happen when you're in a car accident. So hopefully, if something happens, you know what to do. And that's it. So thank you everybody for coming. I really appreciate your time. Bravo!